I started out doing home and auto business insurance, learned about health insurance, liked it a lot better, so I transitioned about 30 years ago to just doing nothing but health insurance. The seniors in our area, they'd all get on a bus to drive to Canada. This was pre-Medicare Part D, the drug portion, the pharmaceutical coverage. So that's probably the first time I realized drugs were getting expensive. The real eye-opener was a lady who needed infusions of Humira. And at the time, Humira was about $5,000. The first infusion, we were starting to monitor the claims because of what was going on. They charged us $29,000 plus for a $5,000 drug. It actually has gotten worse in the last 10 years, significantly worse, especially when you get to not only the specialty drugs, but the orphan drugs. My first orphan drug case, the retail cost was $150,000. And again, unfortunately, the Cleveland Clinic charged us over $600,000 for that drug. It's just insane. There's an awful lot of abuse. There's 14 different ways to hide cost in a drug plan. If you're with one of the BUCAs, you have no idea what's going on for a couple of reasons. One, you can't see the actual contract between the insurance company and the pharmacy benefit manager. Two, if you did get a copy, most of us wouldn't know what it says because of the way the language is. All the drugs that have been starting to advertise on TV the last 20 years, if you are, an adult in the United States and you watch sports or anything else on a regular basis, you can probably sing the Jardiance song. That alone should tell you something about how much money is in these prescription drugs, is all the advertising and the way that they've just, saturated the media. And if you have a program in place that's aimed at controlling specialty drugs, like I had a client the first year, they had 270 on the plan at that point. We saved them $410,000 just on specialty drugs that year. With all their rebates the first 3 years, they also saved an additional $218,000. It's significant money. All told, we saved them $1.9 million in 3 years. That's significant. The insurance companies, the big ones, are playing games with this whole notion of transparency. And it's not just with pharmacy claims, it's all your medical claims too. Unless your company has a plan where you're using a transparent PBM to begin with, and you have someone monitoring the claims on a day-to-day basis, and you're attuned to the high-cost people especially, unless you have those three things, you have no clue what's going on. And you're spending hundreds of thousands of extra dollars that you don't need to spend. You're just wasting money.